Welcome back guys. Now in this video, let's discuss about the carbon dioxide transport. Okay, already we have discussed about the oxygen transport. Also we have seen oxygen hemoglobin dissociation curve which is in sigmoid shape. Okay, that right shift, left shift we have discussed. Now in this video, let's discuss about the carbon dioxide transport, how the carbon dioxide is getting transported from your tissues back to your lungs. Okay, so for that, now let's draw a simple diagram. Let's say this is your alveolus, and you know in your alveolus the carbon dioxide concentration is going to be less when compared to the amount at your tissues. Tissues have high amount of carbon dioxide, high partial pressure of carbon dioxide is there at the level of tissues, and at the level of alveolus you will be having less partial pressure of carbon dioxide. So carbon dioxide will be transported from high partial pressure towards low partial pressure. Okay, from the tissues towards your lung. How that happens? Look here guys. Let's say here, this circulation which I am showing in blue color, this is your venous blood. This blood which I am showing here in red color, this side, let's say this is your arterial blood. Okay. So venous blood on one side, arterial blood on other side. Here are your tissues. Your tissues take oxygen and what do they produce? Carbon dioxide. Okay. So your tissues are producing carbon dioxide. Now where will this carbon dioxide goes? Carbon dioxide, it's a lipid soluble gas. So it will enter into your blood. So carbon dioxide is entering into your blood. After entering into your blood, where will this carbon dioxide goes? Carbon dioxide will cross the lipid membrane and it will enter into your RBC. Let me show the RBC here in pink color. So this RBC, which I am showing here, this RBC is going to take that carbon dioxide. Okay, so carbon dioxide enters into the cell. After entering into the cell, what will this carbon dioxide do? It's going to react with the water. What is this carbon dioxide doing guys? Carbon dioxide is going to react with the water. See, the carbon dioxide reacts with water within the RBC, forming H₂CO₃. Now this H₂CO₃ with the help of enzyme carbonic anhydrase is going to split into HCO₃- and H+. Okay. Now what is the problem? The problem is, see, the carbon dioxide is converted into bicarbonates. Okay, we already know this. Carbon dioxide is majorly transferred in the form of bicarbonate. That to 70% in the form of bicarbonate in the plasma. We know that. But during the production of these bicarbonates, H+ is produced. Protons are produced within the RBC. This H+ is an acid. So definitely it's going to cause a damage to the RBC. So what we have to do? We have to neutralize this H+. So who is going to neutralize this H+? Who will accept this H+? Who will bind with this H+? Is the hemoglobin. Okay. So the hemoglobin, whatever is present here, see the hemoglobin within the RBC, it is going to accept the H+. It will bind with the H+. Okay. So the H+ is now neutralized. So there is no problem for the H+ now. Now this bicarbonate, whatever is produced, so this bicarbonate, now it will come into the plasma. Okay, the bicarbonate, what it is doing, look here carefully guys. Bicarbonate is coming out into plasma, HCO₃-. If you want to send one negative ion out of the cell, you have to take one negative ion into the cell to maintain the electron neutrality. Okay, so this bicarbonate, whatever has gone out, is exchanged for chloride ion. So chloride will come into the cell. So look here carefully. Who is coming in? Chloride will come into the cell. Okay, let's say here is a chloride. Okay, chloride is coming into the cell. So in exams, they will ask you the question. Bicarbonates are exchanged for which ions? Bicarbonates are exchanged for chloride ions. H+ is accepted by, H+ is buffered by hemoglobin. Carbon dioxide is converted into bicarbonates. Bicarbonates are getting transported in plasma. Okay, so 70% of the carbon dioxide is transported in the form of bicarbonates in plasma. Okay, done. Now, this shift, chloride is coming into the cell. Okay, bicarbonates are going out of the cell, chloride is coming into the cell. This shift is called as chloride shift, also called as Hamburger's phenomena. Okay, Hamburger's phenomena. Okay, Hamburger's phenomena, also called as chloride. Now, look, this venous blood, it is going to come towards your lungs. Okay, venous blood is coming towards your lungs. So, what happens at the level of your lung? Exactly opposite things will start to happen. Okay, opposite things will start to happen. Look, see now, at the level of lungs, you know, who is available? Oxygen is available. So, oxygen is coming. Okay, so what happened to the partial pressure here? The partial pressure of oxygen in your arterial blood increases. So, now oxygen is coming. So far, hemoglobin is satisfied with H+. Hemoglobin is binding with H+, happy with the H+. But what is happening at the level of lung? Oxygen is coming. So, hemoglobin have to release the H+ and it have to bind with the oxygen. So, now at the level of, look, at the level of lungs or alveolus, as the oxygen is coming, okay, with high partial pressure, hemoglobin, what it will do? Hemoglobin molecules, dekho, hemoglobin, it is going to bind with oxygen. So, what happened to the H+? H+ is released. So, hemoglobin, it is releasing the H+ now. H+ is free. So, at the level of lungs, at the high partial pressures, these bicarbonates, whatever have gone out, the bicarbonates will come again into the cell in exchange for chloride. Chloride will again go out. This is called as reverse chloride. Okay, reverse chloride shift occurs at the level of lungs. Okay, now this bicarbonate, it will bind with the H+. The bicarbonate is going to bind with the H+, forms H₂CO₃. Now this H₂CO₃ is going to split into, carbon dioxide as well as water, carbon dioxide and water. And you know, this carbon dioxide from the RBC, it is going to get lost into the alveolus. It is going to go out, and from the alveolus, carbon dioxide will go out of your. So, this is how the carbon dioxide is getting transported. Okay, so carbon dioxide is transported in the form of bicarbonates in the plasma. Okay, same thing I will show you in a different diagram, same events. Okay, let's look here. Guys, see, right now we are discussing about the carbon dioxide transport. I have told you, your cells, okay, your cells are going to produce carbon dioxide. Right now I am talking at the level of tissues in the venous blood. Okay, so carbon dioxide first comes into your blood. From the blood, carbon dioxide will go into the RBC. In the RBC, carbon dioxide react with water and forms H₂CO₃, carbonic acid. This carbonic acid is going to split into H+ and HCO₃ minus. Okay, H+ and HCO₃ minus. See, the H+ whatever is produced, it is buffered by hemoglobin. It is buffered by hemoglobin. And HCO₃ minus is going to go out into the plasma. In exchange for which ions? Chloride ions. This is called as Hamburger phenomena or chloride shift. But what happens at the level of your alveolus? See, at the level of your alveolus, hemoglobin is going to release the H+. Whenever there is high partial pressure of oxygen, hemoglobin will release H+. The binding of, listen carefully, the binding of oxygen with the hemoglobin. Oxygen will come and bind with the hemoglobin. The binding of oxygen with the hemoglobin causes the release of H+. Now, this H+ will be accepted by HCO₃ minus. See, at the level of lungs, HCO₃ minus coming into the cell. Again, chloride is going back. This is called as a reverse chloride shift. Okay. So, now, both of them, they will fuse and forms again carbonic acid. With the help of enzyme carbonic anhydrase, again carbon dioxide is produced. So ultimately the bicarbonates are again converted back to carbon dioxide form. Now this carbon dioxide will go into your lungs, and from your lungs it will go back into your, go out into the environment. Okay. So this effect, look, binding of oxygen to the hemoglobin, leading to the dissociation of H plus, leading to the expulsion of carbon dioxide. Okay. So binding of oxygen leading to the dissociation of carbon dioxide. Binding of oxygen leading to the dissociation of carbon dioxide. This effect is called as Haldane's effect. Okay, Haldane's effect. What is Bohr's effect? Look here guys, what is Bohr's effect? Bohr's effect already I have told you. See, Bohr's effect means it's the release of oxygen to the tissues. Okay, what is Bohr's effect? Bohr's effect is the release of oxygen molecules from the hemoglobin to the tissues. Why? You know, at the level of your tissues, there is hypoxia, less partial pressure. So, at the level of your tissues, there is a less partial pressure, high temperature will be seen, 2,3-bisphosphoglycerate will be seen. Okay, more acidic environment will be there. So, at the level of your tissues, due to the acidosis, hypoxia, high temperature, the hemoglobin will release the oxygen molecules, to the tissues. So that is called as a release of oxygen to the tissues. That effect is called as a Bohr's effect, occurs at the level of tissues. Then what is Haldane's effect? Haldane's effect is binding of oxygen leading to the dissociation of carbon dioxide. Okay, Haldane's effect is loading of oxygen to the hemoglobin leading to the release of carbon dioxide to tissues. This is called as Haldane's. Okay, Haldane's. Okay, so with this we have also completed the topic of carbon dioxide transport. Hope the video is helpful. Thank you.